Assalamualaikum warahmatullahi ta'ala wabarakatuh, and let's to everyone. I'm Muhammad Fakhruddin with my another 5 roommates, which are
Noor Farah Diana binti Omar, Kausar Nasreen binti Ahmad Jamil, Noor Raihan Sari binti Abdul Rahman, Noor Farahani Zainadi binti Zainul Akmal, Karina Malika binti Khairul Riyal.
So our topic of discussion today is about National Plan of Actions for Nutrition of Malaysia 3. So what's the policy? Let's find out.
The National Plan of Action for Nutrition Malaysia 3 is a key initiative by the Malaysian Ministry of Health aimed at addressing Malaysia's dual burden of malnutrition. These include rising rates of obesity, diet-related disease, and persistent issues like undernutrition and micronutrient deficiencies, particularly in women and children. The plan, running from 2016 to 2025, focuses on improving nutrition through a multi-sectoral approach involving government, industries, and communities. Its goals are to promote healthy eating, active lifestyle, reducing nutrient deficiencies, and ensure food safety and sustainability. Despite its comprehensive framework, NPANM3 faces challenges including poor implementation of guidelines such as school canteen guidelines, lack of political commitment, and fragmented coordination among the stakeholders. There is also a widespread lack of public awareness about nutrition, especially in rural areas, and limited healthy food environment with cheap and healthy options readily available. Effective monitoring and public education are needed to ensure the success of the plan and meet its 2025 objective.
The main objective of the national plan is to promote maternal, infant, and young child nutrition, ensuring that mothers and young children receive adequate nutrition for healthy growth and development. The second one is to promote healthy eating and active living, encouraging healthy dietary practices and physical activity among the population. The third one is to prevent and control nutritional deficiency, addressing deficiency in essential vitamins and minerals. The fourth one is to prevent and control obesity and other related non-communicable disease, tackling issues related to the obesity and diet-related disease. The fifth one is to sustain food system to promote healthy diets, ensuring that food systems support healthy eating habit. And lastly, supporting effort to promote food safety and quality, enhancing food safety and quality standard. The first key strategy for National Plan of Action for Nutrition of Malaysia is multi-sectoral collaboration by adopting a whole-of-government approach that involves various ministries such as health, agriculture, education, and welfare. So each year, at least one program in other ministry integrates a nutrition component, highlighting that nutrition is not solely the responsibility of the Ministry of Health. Coordination is managed through the National Food Safety and Nutrition Council and the National Coordinating Committee on Food and Nutrition, with enhanced cooperation with United Nations agencies and Asia countries to implement nutrition strategy effectively. Next is targeted intervention. Targeted intervention focuses on vulnerable groups like infant, young children, pregnant women, and the elderly. So efforts include promoting breastfeeding, micronutrition supplementation, and dietary education, alongside activities such as cooking demonstration and hand-maintaining intake. Nutritional surveillance for children under 5 tracks vital indicator to inform policy and program planning. And for the elderly, the strategy include the distribution of education materials and development of specific dietary guidelines, with training modules designed to improve nutrition knowledge and care skills. This approach aims to combat malnutrition and ensure food security through coordinated and inclusive effort.
instead promotions of diet and healthy lifestyle. This policy focuses on promoting healthy lifestyle and healthy eating for all levels in Malaysia. It incorporates targeted programs across various sectors in Malaysia, including child care centers, schools, universities, and even community institutions. For example, we have KAMAS, MOH, JPNIN that have been encouraging parents through workshops to encourage healthy eating for all their children. In school, a new canteen guidelines are practices to ensure that nutritious meals are provided. while universities are running nutrition promotion activities to improve student well-being. Next, we have strengthening food security. What is food security? Food security is a key focus of Malaysia's National Plan of Actions for Nutrition 3. It aims to ensure that all Malaysians have access to nutritious and healthy food from farm to table. In order to achieve this objective, the plan also integrates nutritional considerations into the food supply system, working closely with the Ministry of Agriculture and also agro-based industry. This includes activities like incorporating nutritional elements into community food distributions and also adopting tools like the Nutrition Enhancing Agriculture Food Supply Calculator. The policy also promotes community gardening, encouraging local productions of fruits and vegetables, and even the use of less commonly used crops such as quinine, babangan to diversify food sources. By freeing collaboration between government, universities, and also NGOs, Malaysia is creating a sustainable food system that supports better nutrition. That they just want to ensure long-term food security in our Malaysia context.
Malaysia's National Plan of Action for Nutrition 3 is a comprehensive and forward-thinking strategy aimed at improving the nation's nutritional health. Its trend lies in its multi-sectoral approach, targeted interventions for vulnerable groups, and evidence-based strategies. One of the plan's greatest strengths is its comprehensive multi-sectoral approach. By integrating health, agriculture, education, and community development, the plan ensures that nutrition is a national priority. For example, agricultural policies focus on food security, while school programs teach children about healthy eating habits. This collaboration prevents duplication of efforts, optimizes resources, and ensures that every sector contributes towards shared nutrition goals. The plan also excels in its targeted interventions for vulnerable groups such as pregnant women, young children, and infants. Programs like breastfeeding promotion and school-based nutrition initiatives ensure that these groups receive the nutrition they need for long-term health. For example, iron and folic acid supplements for pregnant women help reduce anemia and ensure healthier pregnancies.
The National Plan of Action and Nutrition of Malaysia 3 is a comprehensive framework designed to address Malaysian nutritional concern. However, it faces several challenges in achieving its nutrition action target. One of the main weaknesses is the lack of collaboration between sectors and stakeholders, which require collaboration from multiple ministry and government agencies. This lack of sectoral coordination results in a smaller numbers of government departments actively participating in policy success, as less involved entities are less aware of the scarcity of the resource and the general nutritional importance. Lastly, the monitoring and evaluation mechanism of the NPANM3 policy has several weaknesses, including limited feedback and customization. Feedback from the community is crucial for determining the effectiveness of the policy and ensuring proper implementations of nutrition-related programs. If positive feedback is received, the policy can be improved to ensure proper implementations of nutrition-focused programs.
The first recommendation that can be done is raising public awareness about nutrition. It is vital because many Malaysians lack knowledge about healthy eating. For example, study shows that high consumption of sugar contribute to rising obesity rate. To address this, campaign could use a relatable example like showing how swapping sugary drinks for water can reduce daily calorie intake. Schools are crucial because habits formed early tend to last. For instance, integrating lessons on reading food label into a curriculum teaches children to make informed choice. Additionally, collaborating with influencers who share simple, budget-friendly, healthy recipe on social media can effectively reach younger audience. The second recommendation that can be done is by monitoring and evaluation system. Robust monitoring systems are essential because they help identify what works and what doesn't. For instance, without regular data, we may not realize that malnutrition persists in certain rural areas. A practical example is conducting biannual nutrition survey to track changes in dietary patterns. If survey reveals low fruit and vegetable intakes, targeted intervention can be introduced. Similarly, a centralized database ensures that health department and policymakers have quick access to accurate data for decision making. Expert evaluations also provide an unbiased perspective, ensuring the plans stay effective. The third recommendation is by resource allocation. Effective resource allocation is necessary because a lack of funding or manpower can delay implementation. For example, rural clinics may not have enough trained nutritionists to educate communities. By increasing government funding, more nutritionists can be hired and trained to deliver workshops in undeserved areas. Public-private partnership also bring resources. For instance, a food company might sponsor community health program or donate fortified food to combat deficiency. Collaborating with international organizations like World Health Organization can provide both technical expertise and additional funding.
NPAAM3 is an ambitious plan to tackle Malaysian nutrition issues, focusing on few groups such as children and pregnant women. The strategy emphasizes multi-sectoral collaboration, sustainable food system, and education. Its success relies on consistent implementation, adequate funding, and strong monitoring. Ultimately, NPAAM3 aims to improve public health, enhance productivity, and create healthy society, contributing to Malaysia's long-term development.
Ah,